post-stroke hand rehabilitation is a huge challenge for the patient and the therapist. The big goal is to reach everyday relevant hand functions like grabbing and releasing objects. The repeated use of these functions will further improve them and become a part of the rehabilitation process. I often experience that stroke patients get to less effective therapy time, especially for hand rehabilitation and in the outpatient area. That leads to a phenomenon called learned non-use. That means little hand functions reduce or even gone lost, and the big goal gets out of reach. Independent training is an important part of the rehabilitation to get the necessary high amount of effective therapy time. For a stroke patient with no to minimal hand function, these therapeutic approaches are based on cognitive tasks like motor imagery or observation of movement, or based on optical illusion like the mirror therapy. On later stage of hand rehabilitation, where the patient can perform simple tasks like grabbing and releasing an object, therapy approaches like forced use therapy or constraint-induced movement therapy are used to further improve hand functions. Immersive virtual reality is a new kind of therapy setting that makes it possible for the patient to perceive both hands as active hands in the virtual world. If the patient has little hand functions that are not relevant in the real world to perform simple tasks like grabbing and releasing objects, these little activities can be measured and can be used to control the virtual hand, so the patient gets the impression of the control of the full range of motion in the virtual world. So the combination of virtual reality with EMG biofeedback makes it possible to bring the effective therapy approach of forced use therapy to an earlier stage of hand rehabilitation. The virtual world has the advantage that the patient has to respond to events, which is very important for the attention and the focus of the patient. The training's intensity can be adjusted, which is very important for motor learning. Little improvements can be shown, and the increased motivation of the patient through the gamification of the therapy. Psi.rehab is designed for mobile VR. Using low-cost devices like a smartphone makes it a perfect setting for home use to increase the therapy time. And that's the important thing, to prevent learned non-use and to reach the big goal of everyday relevant hand functions.